What?
I'm doing my trauma assessment.
All
Is my
right.
scene safe?
Scene safe. You are called for a motorcyclist down on a busy four-lane highway on a warm, dry summer evening. PD and FD have the scene secured and access is safe for EMS. Patient was not wearing a helmet and patient is approximately 30 feet from the motorcycle.
Okay. Do I have bystanders that know the patient?
No.
Does
You do
anyone
not.
know any medical history or any medications or allergies?
No one on scene appears to be familiar with the patient.
Okay, sounds good. When I walk up, do I have someone holding C-spine already?
No.
Do you hold C-spine for me?
Actually, the bystanders do state that the patient was going 50 miles in a 40-mile-per-hour zone.
Okay.
Lost control, laid his motorcycle down.
Okay, so no other patients are involved, it's just this one?
Just this one.
Perfect. Okay, do I see any major bleeding as I walk up?
Patient is spitting blood and has some blood from his left ear.
Okay, when I suction, does it clear?
Yes.
Okay. Before we roll him over, I'm gonna do a quick assessment of the spine.
Nothing abnormal on the spine. There's road rash on the left side of their back.
Okay. I would put a backboard under him, and then I'm gonna have your help rolling him over on your count.
We have 7.
And then I would have someone put on a seat collar, but first, before any tracheal deviation or JPD.
I don't believe so, no.
Okay, so seat collar would go on, and then I'll do my initial assessment. Do I feel any deformities?
There's
bumps?
a golf ball sized hematoma to the left parietal area and skull depression on palpation.
Okay, and has he opened his eyes at all now that I've touched him?
His right pupil is larger than his left.
Okay, but has he opened his eyes on his own, or is he still unconscious?
He's groaning and moans to
Groaning?
pain.
Okay. So, which pupil? The right pupil?
Right pupil is
Right
larger,
pupil is
yes.
larger? Okay. Do I notice any deformities on the face?
Face, I don't believe so, no.
Is he breathing on his own?
Yes. 18 breaths per minute.
Okay. And his airway is clear?
Yes, once you did the suction.
His breathing, is it bilateral?
The left side is not moving.
Oh, okay.
Okay.
I just
Continue
checked earlier
to
today.
go through and
so I
note
was-
that, and I'll get to that later. Anything on the arms?
Perfect.
No.
Perfect.
CMS on the arms?
Intact.
Okay. The chest, you said that there was a flail on the left side, or that it wasn't moving. Is it a flailed chest, or is it just not moving?
We'll say not moving.
Okay. What about the abdomen?
Abdomen is soft and non-tender with an abrasion on the left side.
Okay. Pelvis?
Mush.
Mush. Pelvic binder. Legs?
Legs are not notable.
CMS?
Intact.
Okay. So now I would come back here and
I know things.
take a full set of vitals. I'm also going to.
I did tell Matt that we had to use the supervisor card on every single transfer we did that night.
Yeah,
Well, you said it wasn't.
I've been having to push.
I didn't feel crepitus when I was touching his chest over here. It just wasn't moving.
Left side crepitus.
Left side crepitus. Okay, so yeah, I would just wrap some like
What do you mean you need a GNR? We've always needed.
bandage around
Some
that
for
area.
recently have been like, you need a face sheet?
And then what are the first set of vitals?
I have blood pressure 150 over 100, heart rate of 88,
Almost 10.
respirations 18, SpO2 90%,
Next
and blood glucose 100.
Okay. He's still breathing fine on his own. I'll put him on 10 liters non-rebreather for oxygen. I will want to continue to do blood pressures. Let me listen to lung sounds.
Sure. Left side lung sounds are absent, and right side are normal, I believe.
Okay, so I would
But if they die in the
watch for the
ambulance, I
blood
need-
pressure for narrowing pulse pressure.
Otherwise, as long as they
For
give
that
you,
tension.
like if they give you the printouts.
Later on as treatment is continued.
Standing,
Um,
that's fine.
But they just didn't even know that we
I
needed
would
it.
package him up and put him in an ambulance.
I more or less have a problem with United.
And I would transport to the nearest ER.